I'm Sara Pirzadeh-Miller, and I am a certified genetic counselor and associate director of our cancer genetics program at UT Southwestern Medical Center, Simmons Comprehensive Cancer Center in Dallas-Fort Worth. So I was so pleased to speak today to really discuss some really important research that's happening in the world of germline genetics. We discussed 4 abstracts today. 2 of those abstracts surrounded individuals being tested for inherited prostate cancer risk. And the first of those 2 abstracts really discussed issues with disparities in individuals that are obtaining prostate cancer related germline testing, comparing individuals that report on the test requisition form that they are African American versus those that report on the test requisition form that they are white, and looking at the rates of variants of uncertain significance, of germline mutations that are of clinical significance, and of different demographics. And what I think is really interesting is it really shows us we have a lot more work to do when it comes to understanding all of the different variants that are found in those that are African American versus those that are white or of other backgrounds. We also know that the rate of variants of uncertain significance are much higher in those that report African American ancestry on their test requisition forms. And so we need really to inspire and do more research when it comes to understanding what these mean and then how that impacts the rate of clinically actionable gene mutations that we find in this population. What we know is that based on that study, the number of genes that were impacted in those that are African American were less than those that are white. And so what we really need to understand better is, are those variants of uncertain significance actually, once they are resolved, maybe that's going to show us that there are more genes impacted in those that are African American than what we thought. And also that we really need to promote inclusion and understanding of how we can better serve this population. Another one of these abstracts related to prostate cancer related genetic testing was specifically looking at those with metastatic prostate cancer, which are all indicated for genetic testing through NCCN guidelines. And in a specific area of the country, in Western Washington, where a population of those that report metastatic prostate cancer cases were reached out to via a postcard to then get individuals to enroll in the study. The study was called the GIFTS study. And the idea was to really try to lower barriers to access to germline testing if they were invited into the study and if it were free to have that genetic testing. So if individuals reported they'd already had genetic testing, they were excluded from the study. But if not, then individuals were able to get testing through a laboratory called Color, and to look at several genes related to prostate cancer risk. And what they really looked to see was if you facilitated getting testing, information and access, lowering barriers to access in this population, would that intake increase? And really what would happen? What would be those outcomes? And what they did see was that those that reported germline testing prior to the study, I believe was only about 11%, but then after outreach through the study, it was 41%. So that outreach did seem to be impactful. And what it really showed, again, with the demographics of those who were even interested, it was pretty classic in terms of those that normally get germline genetic testing in the literature anyway, those that are white, those that are college educated, those with a higher median income. And so what it really showed us, I think, is the continued disparities that exist in diverse populations when it comes to those with metastatic prostate cancer getting the germline testing that they need. And so ongoing research that needs to be done for us to all do better when it comes to making sure that access is there for all populations, no matter where they may be. The final 2 abstracts were related, one to a study that is ongoing right now called the BRCA-P or BRCA-P study. It's a phase 3 clinical trial looking at denosumab as a risk-reducing agent for breast cancer in women that report and are proven to have BRCA1 germline mutations. We know that this population really needs a better alternative because what is out there right now is just not being used. And so this study is really looking to understand if denosumab is going to be a viable opportunity for women at very high risk for breast cancer because of a germline BRCA1 mutation. If they take this, will this truly lower their breast cancer risk? Will this impact their health and quality of life? Is it efficacious? What is the understanding? What is the opportunity here with this particular drug? So this study by Dr. Boulani and colleagues is ongoing. It's a randomized randomized 1-to-1, so individuals with a germline BRCA1 mutation that are female, meeting certain inclusion criteria, receive denosumab 120 milligrams every 6 months for 5 years. Those that are on placebo, obviously in that arm as well, and then comparing all of those outcomes. It's multiple sites, international, very exciting, and this abstract just served to describe that work that's ongoing right now, so there's a lot more to come when it comes to seeing what happens with that research. And the final abstract that we discussed today was related to individuals from a high volume lab that carry more than one germline mutation, meaning a pathogenic or a likely pathogenic variant, and really looking at some of the characteristics of that population. And so this population, some of the salient results that came from this, number one, that those with CHEK2, more than one, 2 or more CHEK2 mutations, were found to have more cancers reported in the family and more breast cancers reported than those with other multiple pathogenic or likely pathogenic variants. And what was also discovered was that breast cancer was the number one malignancy that was most commonly reported in this population with multiple pathogenic variants. Now, the multiple pathogenic variants were found in genes that were more commonly associated with breast cancer. So to me, that's not necessarily a surprise given the genes that we were looking at here. But also of interest, that it really showed too that those that report multiple pathogenic variants did not seem to have a lower or a younger onset of their first cancer than those that report one pathogenic variant in a high penetrance gene. So I think that this type of study is really impactful for genetic counseling and for those that are talking to these multiple mutation carriers, so that they can really understand how to better counsel their patients. More research needs to be done, but I think it was really promising to see this number and to see this data, because I think it's going to really help us understand how we more positively impact these patients and the guidance we give them for their care. The abstracts presented today, I think, had really promising and critical information that's going to be impactful for practice. I think if I had to pick something, really that popped out at me from this data that I presented today, one of these things would be, I think, the ongoing disparities that we see in the world of genetic testing in diverse populations, but especially in the world of individuals with prostate cancer or metastatic prostate cancer. And really, I think it was promising to see that when the information was brought to the population, those individuals were interested in testing and followed through with it. I think that was an incredibly critical piece, and I think that's what it tells us as clinicians, that we need to do better when it comes to tailoring outreach, tailoring education to different diverse populations so that we're reaching them where they are. And right now we're not doing that, but I feel like one of these studies today really showed that if we do that, we will see success. And I think that that's in the world that we live in today, and understanding how we need to be better and do better when it comes to multiple populations and really understanding their needs. This data really highlighted that. And I think that that's a really critical piece for practice going forward.